Welcome to HEA's HypnoConnect, the podcast by the Hypnosis Education Association. Real conversations, expert insights, and meaningful connection. Brought to you by HypnoBiz in a Box, the ultimate all-in-one hypnosis business platform. Let's get to it. Today, we're excited to introduce Dr. Margaret Wallace. Discover the science behind hypnotherapy, its applications for various conditions, and real-life case studies that showcase its transformative power. Dr. Wallace will present on hypnotherapy in the U.S. prison system, drawing from her 25 years of experience to explore the profound impacts of hypnotherapy on mental, emotional, and physical well-being. As a licensed psychologist, advanced clinical hypnotherapist, and author, Dr. Wallace brings a wealth of expertise to the table. She's pioneered the introduction of hypnotherapy into the prison system as a clinical director, demonstrating its potential for transformative change. We'll let Dr. Wallace take over here in just a moment, but for now, your hosts for HypnoConnect, your HEA president, Melanie McCool, and HEA's vice president, yours truly, Sean Bray.
Awesome. All right, and we're
Hello.
Hello.
Yeah, there's I'm reading through a lot of the comments here from the event posting. People are fascinated by this subject, and we're just super thrilled to have you here.
Yeah,
I'm so excited. I'm so excited and ready to share, ready to talk.
brilliant.
So,
And,
ready to go.
yeah, we have to start with, well, how did you get into this? Because what you told me was just like, it's wonderful. So why don't you let us know, how did you get into hypnotherapy, and then how did you get into the prison system? Why did you do that?
Why in the name of all that is holy?
Right.
Okay, so let me start at the beginning. I was 29 years old, and I was the staff counselor at the University of Mississippi. We call her Ole Miss. Many people think of University of Mississippi as Ole Miss.
Yes.
As a staff counselor, I joined a group of other counselors in the center to go do some CEUs. You know, we thought, yeah, this hypnotherapy training sounds interesting. Let's go, let's just check it out. Well, talk about transformational. We participated in a 6-day intensive training with Diane Zimberoff, and she's the director, creator, owner of the Wellness Institute. They're in Issaquah, Washington. And her brand, her style is called heart-centered hypnotherapy. So we went and, as part of the training, you yourself, as a therapist, you're experiencing the process as a client, and shifted so many things for me. I was 29 at the time, but I'm just going to prep some people. The story might be a little hard to hear. At 21, first of all, I sound a little different. I'm from a little island in the Caribbean called Dominica, not to be confused with the Dominican Republic. We love them, but they're a different country. Mm-hmm. We're further south between Guadeloupe and Martinique, which are two French islands. And so, they're islands, so they're surrounded by water, of course. So there's a lot of water business. Yeah. So my mother worked on the water, essentially. She was what we call a huckster. She sold produce from my dad's farm to different islands. Mm-hmm. And so she was on a boat, headed from my little island of Dominica to St. Martin, and the boat sank. Her body was never recovered.
Wow.
Yes. So suffice it to say that the 21-year-old began a state and a process of prolonged grief. And every day I was in pain. I hurt every day. So by 29, I had moved over to the US, had done my education as a counselor, and was working at the University of Mississippi. And so that's the first time I began to address that grief. That's the very first time I began to address that grief. And it started me on a healing process, a healing journey. I had not been able to get a grip of it before hypnotherapy. And so for me, being able to get relief after 8 years of suffering, after 8 years of suffering almost every day, nobody had to sell me on hypnotherapy.
Right.
Yeah. And then I went back to the university, started working with some of the people I had been working with before using talk therapy, which is great, evidence-based. But I'm telling you, grown men who had had difficulty verbalizing their pain, their grief, their deep traumas from childhood, within 15 minutes, were back at the source of the pain, bawling, releasing, resetting, recalibrating their thoughts they had formed about themselves as kids, because that's what we do as kids. We do the best we can with limited information. And so I've learned over time that hypnotherapy is one of the most powerful processes to help the adult go back and rescue the child.
Right on.
And I just want to interject for a second. If there's anybody listening that's interested in hypnosis, you're not a hypnosis practitioner, but you're interested in it, know that I've talked to thousands of hypnotherapists, being the VP role. And this is a story that's it's a theme across the line, really. Most hypnotherapists had some, experience it with themselves. And it was impactful, so impactful that they shifted the direction they were going in their careers and everything to do this, for themselves. And then, we're just compelled to help others, So
Absolutely.
Anybody listening, this is not just a hit and miss story here. This is a theme I hear every day.
Yeah. And comment if this is your story or similar. Yeah.
You may
Absolutely.
continue. Please continue.
Yes, absolutely. And so, in 2021, at the end of 2021, more grief. Yeah. My fiance passed away suddenly.
Oh my.
This time I knew not to wait 8 years.
Mm-hmm.
So this time I knew to go right away towards hypnotherapy to quickly process, reset, to be able to move through.
Yeah.
To be able to move through. So I'm 2.5 years in, feeling really good when I compare it to that
Right.
2021 to 28 year process. Yes. Huge difference.
Just to share, I was really brief. I had a client recently who came for smoking.
Mm-hmm.
And I knew, but she'd mentioned that her husband had passed away, and I could see the grief, feel the grief, knew.
Mm-hmm.
And so it was smoking, but I had to work in a bit of grief work. And her testimonial to me had nothing to do with stopping smoking, though she did. It was that 7 years of pain, anxiety, anguish had, been left on the office floor.
Absolutely.
So what a blessing this
Absolutely.
is.
And I have found this with so many clients over the years that people will come in and say, I am smoking, I want to stop. And then we do a hypnotherapy process. Their subconscious mind takes them exactly where they need to go to find out it's really not about smoking. It's about that thing that happened on the playground at age 7.
Right.
Yeah.
Wow. Right. Awesome. So why prison? And please use the same phrase that you did when I asked you before. Why prison?
Why prison? Why not prison? Okay. Why not?
Guys, it's brilliant.
So I'll tell you, at the University of Mississippi, it's time for me. I'm 29. I'm like, I want to spread my wings and fly. At my core, I wanted to go work in the prison because I had come upon hypnotherapy and I understood how fast it worked and how impactful it was. And I thought, wow, that would be the ideal place to do this. But at the time, I had little babies and my good friends who loved me and, loved my babies said, why prison? Please, no, please do not do it. I said, okay. And so I went on a completely different course. Yeah, I did a lot of private practice and community-based mental health services. But after COVID, after COVID and after some of these losses, I only shared one, but there were more. You know, life asks you to sit and think about what it is you really want to do, you know, so that when you're 65, you're not looking back in the rearview mirror, you know, saying, oh my, yeah, I really wanted to do this and I didn't do it. So in December, I said yes. I said yes to a 3-month stint. You know, I was just kind of testing the waters to see if I really liked it. To a 3-month stint to be the clinical director at a state prison. And I am on board now full time because it is where I need to be. It's where I need to be. When people ask me, why a prison? I say, well, especially people who grew up with a Christian background, right? A lot of people ask, why did you put yourself in that space? There are a lot of bad people there. And I try to remind them that the book that they love to read a lot has a story in there where the guy that they like a lot, called Jesus,
Right.
yes, he said, well, you know, when it's time to come to me, I'm not going to be so focused on the people who are saying, Lord, 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 Lord. I'm going to be looking at the people who fed the hungry and went to visit people in prison. So I said, hey, I think I'm in the right spot.
Right
I'm in
on.
the right spot. I think I'm in the right spot.
And so the phrase you used when I asked you, you said, I wanted to do this my whole life.
I really did. I wanted to do it my
And
whole life.
we both looked at each shit. We're like, wanted to work in the prison system.
But
You know, when I was coming in this morning to work, and as the gate slammed behind us, there was the corrections officer standing right there. And she had begun a conversation and she said, you know, we are special people with a special, you almost get a tap on your shoulder to really sit and be comfortable doing that kind of work. Because it is intense.
yeah, that's interesting. And I've always thought that about, nurses,
Yes.
those who work with like in situations that I could never be comfortable.
Yes.
And I don't know that I couldn't be comfortable in the prison system. I probably could be more comfortable in the prison system than as a nurse, actually, because of the stuff that they have to do. But
Yes.
I hear that. I get that.
I would imagine everybody in the prison system could use some hypnosis, not just the prisoners,
Absolutely.
the guards,
Everyone, no joke.
Absolutely. Yes.
Yeah.
Awesome.
Absolutely.
Hey, Matt, and since you're here, if you have anything you'd like to ask Dr. Wallace while we're here, at any time, you can unmute and ask away as well.
Okay, thanks. Yeah.
Yeah, cool. Wonderful. So what, if you could tell us one thing about working in the prison
What's
system,
it been like? What kind of,
what would you like people
What's
to really
different about it?
understand?
What I want people to understand is that prison is where the people we see in our private practice who are having trouble feeling well. I say feeling well because I think many of our struggles are because we haven't learned or we don't know how to do it well, how to feel sad. Yeah, we don't know how to feel angry well. Yeah, we don't know how to feel afraid well. These are primary emotions, but we struggle with them. We go all the way with them, or sometimes go all the way on the other side with them.
a lot of people are taught not to feel.
Exactly. We're numb. We're numb or we're hyper emoting. Yes.
Yeah.
Prison is where a lot of our people end up because they really went all the way to the other side. So they're just you and me. They're just you and me. They didn't learn. Yeah. They forgot in the moment they chose. So I was reading the research on the statistics as far as how many people with mental health diagnoses end up in prison. It is very high. I mean, close to 50%. Close to 50% of people have a pre-existing mental health diagnosis. And even if it wasn't diagnosed, they were struggling before. So for me, it's a beautiful place. It's turning out, to be a beautiful place to work because the people, they want the support. There are many people who are getting ready to go home. They want the support. They're terrified because they've been in there for 10 years, 15 years, 20 years, and they're not sure what it looks like outside with all of our new fandangled digital this and that. So some of them are terrified. Yeah. And they're ready. They're ready to.
So is that your primary work is in helping them to get ready to adjust to the outside world, or are you working in all different?
I work with whosoever will may come. So I work with whoever shows up and whatever they present with. So some people are lifers, we call them. They're there for the rest of their lives. And so part of the work is helping them, helping their subconscious, help them come to a place where they can survive, tolerate.
Find some peace. Yeah.
Yes, find some peace.
And that's really no different from when you have, I'm a medical hypnotherapist, so doctors send me people with medical issues, and my job is to help them to feel at peace with whatever's going on, so they have less stress, less, sad, all of that. So
yes,
that's
yeah, and to remember that even if physically, so the physical structure has incarcerated you, so you're closed in, helpless, powerless. Really, mentally, you still have power. And so how do you remember how to use that? How does your subconscious mind remind you? Yeah. And teach you, steer you to how you can do that.
Beautiful. Yeah. Do you think that, all the work that you did outside in your private practice and working in the community, obviously it prepared you to work in this situation. So do you think it's very much different? I think maybe people who are watching think, oh, I'd really like to work in a situation that was desperately needed like that.
Yes.
Right? Do you think that you need some special training to get in there and do that? Or is it, if you've got the tools, it's going to...
If you've got the tools, you're fine. So if you've ever worked, say, in an inpatient hospital setting, it's really similar, but it's flipped. So in an inpatient hospital, you might have a few guards.
Right.
Yeah. In the prison, you have many guards, which for me is very comforting because I know I have support on that level.
Yes, of course.
So you're protected. Yes, safety first. But I'm finding, honestly, that the patients really want the support. They really want the support.
Now, you're a psychologist, and was that a requirement for you to serve in that space?
In that role, but there are many master's level clinicians who are not yet even licensed. So you don't even have to have a license because I do a lot of clinical supervision to unlicensed professionals. So you can come in and start, learning the ropes and using that space to share your talents and your gifts and your skills. Yeah.
Matt, go ahead.
Oh, thanks. Dr. Wallace, is there a certain protocol that you prefer or that you find that that the prisoners respond to as far as hypnotherapy goes, hypnosis?
Good question. So in the prison setting, I might have you today and I might never see you again because you might be transferred to another site tomorrow or even the same day. So I tell my patients, my clients, that this might be your last session. I'm also working within the confines of time because the security side has their protocols that they have to enforce. So I'm learning, and I've learned how to get in there really quickly, use abbreviated procedures to get the results I'm looking for the client.
Can you expand on that?
Yes. So I'll give you an example. Last week or 2 weeks ago, I'm seeing and intending, because we had planned on it. And I said we'd planned on it because I wanted to make sure nobody interrupted the session. So, I had a sign on the door So even the security guards could give us a little bit of time to complete the session. I had a 32-year-old transgender female whose stated goal is, Doc, please help me. I keep holding grudges with my partner, right? But I want to learn how to forgive. I want to learn how to forgive. Within 45 minutes, we had gotten to where she needed to get, which is back to childhood and an uncle who had abused her. Yes. And her being able to identify that, restate, speak up
Yeah.
on her own behalf. Now, as a 32-year-old, yes, all in an imaginary state, of course. We understand how hypnotherapy works.
Yeah.
Reset some really negative decisions that she had made about herself
And her
that had
place.
impacted, yes, it had played a role in the choices she made. Yeah. Identify, recover parts of herself that she had left in the experience.
Right.
Do a process in there to reset it, clean it up. Yeah. Reattach it. Keep moving forward. Yes. Create new decisions, new statements. Yeah. That she was going to use over and over and over and over again after we had implanted them during the session to begin to build up a sense of stability. Because in addition to the forgiveness piece, there was a big part about a feeling of confusion. I feel so confused when I have to make decisions. I feel so confused. And that confusion was tied in to the confusion of the child wondering, why is my uncle doing this? I love my uncle, but this is feeling very strange and very weird. Yeah. And all the decisions that the child made about herself back then. Yeah.
So when we spoke, a month ago or so, and I know you saw me get peaked up when you said you were going to be doing case studies and research, because I'm a science guy. And now are some of these things that you're mentioning now, are these being tracked? Are they being, metrics on this, because it's a really, out here in this world, a lot of people are teaching hypnotherapists more packages, series of sessions. And I'm hearing, you better know how to do the one wonder, or you're not going to really make an impact in this system. Right?
Yes. So in my system, that is my challenge. That is going to be a challenge if I'm going to be tracking data.
Yeah.
Because
sunny weather.
Because it's because again, the person could be gone in 2 hours and I might never see them again.
Right. And obviously you're not taking 10 minutes to put them into trance either.
Exactly.
Right.
How do you get them in the trance? Is it different with other people, or?
It's a case by case basis. For the most part, I use a standard eye fixation. We're going down the stairs. We're finding a place that we can call our most comfortable space, most beautiful place. For a lot of people, help them to anchor into a sense of their highest self, yes, or whatever comes to them that shows up as a strong resource, because they might need it during the session. Yeah, they might need it during the session. That's it. And then we cross the regression bridge and we go and we dig up. I say we dig up the weeds, we pull up the weeds, and we plant some new beautiful flowers in there.
Yeah.
Reset, come back. Yes.
Awesome.
Yeah.
So what other sorts of data are you? Do you know what data you're wanting to collect, or are you just starting to figure it out?
I'm starting to figure it out because I'm 6 months in. I'm planning very soon to begin groups. So begin doing it as a group process. That might be that might offer me a more reliable opportunity to collect data, because it'll be a group format. Yeah, there's less likelihood that all 7 people are going to leave next week. It's just very,
Okay.
yeah. You've got to imagine today is the only session you have.
Now, what kind of prison are you in? Are you seeing, males or female? You're in a female prison?
I'm in a male, close security
Okay.
for max. Yeah,
Outside of Atlanta, right?
it's in Georgia.
In Georgia somewhere. Okay. Yeah.
Mhm.
Right.
Yeah.
And wow,
Yeah.
powerful stuff. So
Today. So I'll tell you about, so today,
yeah.
we had one young man, 31, who I'm walking past, and he's like, Doc, please, I can't get the smell out of my nose. What do you mean? What's going on? I can't get the smell out of my nose. I can't get the smell of blood out of my nose. Okay. All right. I've got my lunch in my hand, warmed up. It's midday. I'm hungry, but he's in crisis. Yeah. So I go, we make some time, sit, and we do a quick process. Yeah. Eye fixation down the steps. A beautiful place, favorite place, somewhere in nature. Yeah. And he says this is about me being 11 years old, and my 13-year-old best friend dies in front of me. He's shot.
My goodness.
This is the blood. He's smelling. No, he says, because now he can make the association that it set me on a path that landed me here years later. Yeah.
Right.
And it's still, he had nightmares last night, things like that. So he's still suffering every day. So that's somebody who I know I'm going to be spending time with in the 20 minutes that we have, because there'll be 5 other people waiting to be seen, right? In the 20 minutes.
So is that the usual 20-minute
That's
session?
about it usual, because you just never know. You just never know. 20 minutes. You might have 30 minutes. If you want
Okay.
30 minutes, you might have to make a big plan. Yeah, to get.
Yeah.
I think that actually some people who are watching who've seen many clients would like that it might be normal to see a client for 30 minutes, because you can get it done that fast.
You can get it done that fast. When you know you have to
the
get it done
ritual
that
of
fast.
having it be this, this whole thing.
So something you said earlier about preparation on the outside,
Yeah.
getting me ready for this. In private practice, well, in community-based mental health,
Yeah.
community-based mental health is very similar. You just, where you're doing the session might be in your car, in the client's yard.
Right.
Yeah.
Whatever's going on wherever you are.
You've got it. Yes, because we might not be able to organize going to sit in our beautiful office with our pillows and our scented candles and our teddy bears. Yeah.
Yeah.
Mm-hmm.
Wonderful.
But the process is going to work. The process is going to work. Yeah.
Because you believe and know that's going to work.
Absolutely.
And that congruence comes through, and that's why the client can get the relief that they say, can you? And you say yes, and you do. And they go, oh, thank you.
At the very least, I'm going to help a person get to some space of de-escalation.
Yes.
Even if we don't have time to go into the healing work, the resetting and all of that stuff. Yeah. Mm-hmm. At the very least, I will plan to help a person leave me feeling better. Yeah. Or we will make a good attempt.
Dr. Wallace,
yes.
What, for lack of a better word or phrase, what sort of pre-talk do you do with them? If you
what sort of
20 minutes
pre-talk?
So if we have time, if we have time, I will explain the process. If we have time, I will explain the process. So for my client that I saw 2 Thursdays ago, we had time, we had a nice session, and we did with with her, we did a nice little interview up front because I wanted to find out exactly, what are we going to be working with, and just clearing up some of their misconceptions about hypnotherapy. And yes, but yeah, with the gentleman today, no, there was no time. Yeah, there was no time.
Now, do you know, is this something that's catching on? Are there more locations that have hypnotherapists working in the prisons? Because I've never heard of it before.
Yeah, I don't know. I don't know. And it's kind of like, well, where I am, we have someone who's certified as an EMDR therapist, but it's challenging to create the space to be able to do the work, but I think for me, because I've been able to do this, I mean, over 20 years, I'm doing it wherever we are, we're doing it.
Right.
Wherever we are, we're doing it because we might not be able to do it. Yeah. So I figured out how to do it this in that amount of time. Yeah.
Dr. Wallace, I'm really trying to get my head around how, I guess, I don't like the specifics of a session if you only have 20 minutes. So, the thing of myself, before I actually got trained in hypnotherapy, I thought that all hypnosis was this dream-like state, and now I know that it isn't. And I'm thinking, if I went in expecting that, and then the whole time I'm listening, thinking, well, I can hear her, I can hear people in the hall. I mean, I'm not being hypnotized. You know what I mean? I'm just. Can you share your magic? How do you do it?
So over 24 years, I've come to trust people and where their mind takes them within whatever amount of time we have, because that part I can never control. I've never been able to control it consistently. Let me say that. Yeah, the fire alarm might go off, or, we have to leave the building, whatever it is, right? So I always set an intention that wherever the person's subconscious mind has got to take them, I'm coming with them. Yeah, for the time that we have. What I do know I will always do is I will make sure they leave me, I say sealed up. Yeah.
Yeah.
Sealed up.
Won't leave you hanging
Exactly.
in the hard place, obviously.
Yes. So say there's a guard who's motioning, hey, we've got to, then I advocate, and I'm like, no, we need more time. Yeah. Mm-hmm. It's got to be done, or it's not going to get done.
I really appreciate that, because one of the things that I've learned is if you have a need for your protocols to work, faster, to be easier on the client, whatever it is, then you can create it and it'll work. So you're proof of that, and yes. It just dismisses a lot of what, and also, Matt, I don't know that people who are coming in have any idea about the beautiful dream state that you had as your idea for hypnosis. A lot of my clients don't know. They just don't want to be whatever the heck's wrong.
Exactly.
They don't know what it is. Yeah.
And they're very ready. The people I've worked with are very ready. So it's not as if I'm having to convince someone. We're not working with a lot of resistance here.
Nope.
They're ready. They're asking. They're desperate.
They're asking for hypnosis. They know that it's okay.
Mm-hmm. They're asking. They're desperate. They're asking for relief. And I'll say, I have this thing I can do with you. Do you want to hear a little bit more about it? Do you want to try it? Yes. I'm smelling blood, right? I can't get the scent of blood of my friend out of my nose. Yes.
It's probably like how most people discover hypnosis outside of the prison system, which is, if you were to write down a list, hypnosis would be damn near the bottom of it. Unfortunately. Yeah. Everybody tries everything else first because that's what they've been, taught to do. and then they're desperate when they come to hypnosis. It's like,
Yeah.
regardless of, what the media has portrayed it to be in hundreds of movies,
Absolutely. Now, here's the thing. I think, over time, you're going to not necessarily need the protocol. The protocol becomes a part of you. So I say the therapist is the tool, right? So the protocol becomes you, and you're following the patient.
The lead of the client. Yeah.
I understand now. It's you. You're very hypnotic. They have an understanding of what you do. You're like, they're desperate, and you have tons of prestige. You're just starting off so good, and then it sounds like almost like Reiki. You're just you're intending to heal, and you're intending to meet them where they are. They're subconscious, and then
I'm happy you're mentioning Reiki, because I've learned to incorporate Reiki into the process. I'm a Reiki level 3. I've learned how to use sound therapy, because I'm the tool. Yeah.
I understand now. I was over analyzing.
That was that conscious mind. Mind. Subconscious mind to run for its money. That's what it is.
Now, if someone is watching right now and they're interested in doing this themselves, do you have any advice on how they could get started working with hypnosis in the prison system? I mean, would they just pick up the phone and call the prison? Hey, I want to work. I mean, how do we do it?
How you do it is you've got to come in and work. You've got to come in and work. Again, you're the tool. So this is how you do it. As opposed to saying, well, I'm a hypnotherapist. They might look at you like, no.
Right.
What? That sounds a little woo-woo. Talking about the myths about hypnotherapy, right? You might have to do a lot of work trying to convince them that what you're offering them has been validated by the American Psychological Association, American Medical Association, British Medical Association, right? So, but who's going to argue with a psychologist or a therapist? They're not monitoring my sessions. This is just a strategy. This is just a tool I'm using. Yeah. So I'm not making a big deal about, we're going to have a hypnotherapy session today. No, we're doing our work. And this is a tool that's applicable right now for you. So that's what we're using.
Well, we got the president of HEA here right now, and I'm gonna make a suggestion that we do like what we've been doing with some of these other areas of service, and create a focus group, and we'll help other hypnotherapists know how to get the path to get in. So if they're in Florida, we'll discover the ways to do in the different areas.
You just apply for a mental health counselor position, and there are many vacancies, because it is a prison. Yeah, and again, you're the tool, so you use you do your work with your people when they come.
I really appreciate that. It brings up a lot of questions for me, because as a hypnotherapist out here, I wish that all psychologists, all doctors, all dentists, all who work, actually social workers,
public service in general.
Who works with people. How about everybody who works with people?
I'm imagining officers, beforehand, if maybe they were trained in hypnosis and they were working with these people out in the field before they got arrested, doing their beat.
And our goal is to help hypnosis be better understood and more utilized by more people. And so I would ask, what would you say to any psychologist who might be looking at this and saying, why would I want to include hypnosis in my work? I mean, you've hit on it, because it's one of the tools. It's the tool you get to use.
Yeah.
What would you say?
The first thing I have said because I get this question often, that I have said, especially to many of my peers and many of my trainees, is if I was stranded on a desert island and I had no other healing modality, hypnotherapy would be it. because it's everything.
I'm with you.
It's everything. It's everything. It's everything. And we're working when people are in a state where the brain is ready and receptive to our suggestions, when the brain is focused and attending, and basically like Pac-Man looking for how we can aggregate this information. Yes. And we're building new neural pathways in an hour.
Yeah, totally.
And
Pruning
I have
the
nothing
old
to compare.
neurogenesis happening over here.
Yeah. I have nothing to compare. After I started my first client, I saw my first client when I was 24. I'm 54. I have nothing to compare.
Wow.
Also, I haven't done everything. I've done brain spotting. I'm not an EMDR certified. Because, I'm like, okay, that's enough. Hypnotherapy is it for me. I'm good. I just,
Amazing.
yeah.
Where were you certified?
With Diane Zimmeroff in
Diane.
Sequoia, Washington. Yeah,
That's
I
right.
did say that.
Awesome.
Yeah.
Could you repeat that, Dr. Wallace? Who?
So the name of the teacher is Diane Zimmeroff, Zimberoff, and her style, her method is called heart-centered hypnotherapy. And again, after you've done it yourself, you throw the protocols away because it kind of becomes instinctive in a way. And you add what you see helps this particular patient here. Yeah, so
It really is. Intention really is everything. And I figured out that so many hypnotists worry about what's the best metaphor. I have this person coming in, what's the best metaphor for that? And I've come to the conclusion that this is controversial.
We were all for it. Go for it.
Any metaphor works for anything as long as you intend and you say it in a way that is compelling, and the person knows that they want help. They even you, they believe that you want to help them. I've told the same metaphor for several things.
I think the overarching
Absolutely.
vibe on the story is authenticity. So whatever the metaphor is, whatever the the modality is,
absolutely.
authenticity and intention are freaking where it's at.
And to
Absolutely.
see the person in front of you whole.
Absolutely.
Yeah.
Not as they're
Not as
already whole.
Right.
broken and
Nothing's
whatever.
broken. Nothing's broken.
That's it.
You know.
As just a human being, who did the best they could. Yeah.
Best they knew how. Best they
Exactly.
knew how.
Yeah.
Exactly. And that now is ready, you're right, using this tool to reset, reframe in a state of high suggestibility and focused attention. Is that simple? And we've done a process to bypass the conscious mind, take us to a subconscious level where we can do that. That's it. So really, if you think about it and you understand that that's it, doing it in 20 minutes makes sense. That's what we're doing, because not everybody needs, again, not everybody's resisting. We don't have to be doing all of this confusion and this and that. No, they're ready. They want it. And we're doing it. Yeah, we don't need a deep state of trance for this work. We don't. And so that's why it's worked. It continues to work. Yeah.
Yeah, I imagine, just the stark contrast between where they are in general public, holding, and then getting into a room that's a little quieter and has different aesthetics to it, has a person there that's got some different colored clothes on. And I think it's all part of the induction. It's all part of the hypnosis. So
Yes.
I think the facility itself is working in the favor of fast induction,
I
or
agree.
no induction at all, maybe just NLP-ish, you know what I
Maybe you
mean?
could put some aromatherapy in there too.
No doubt. I was going to
Yeah,
say,
Absolutely.
oh, it smells nice in here.
Yes.
That's very different from out there.
Yes.
Yeah.
You know, Sean,
Absolutely.
that makes me think of like, you know, in Dr. Wallace, this, you know, if you when you go to like a hypnosis conference,
Mhm.
you know, and then everybody's so you can just walk up and just say sleep, and just people just go
right.
Right.
nothing,
Right.
and it's probably it's probably what's going on in the prison. I would think, Dr. Wallace, you probably have so much prestige and mystique and everything, and the just the act of walking into the area where you are, is just like Sean was saying, it's just part of the
Yes.
induction, and
They've already
That's
blessed themselves knowing that they're walking through that door. So it's,
I bet they're so much easier
Yeah.
than just someone on the outside, so to speak.
Absolutely. You know, another suggestion that I always give, always, is every sound you hear helps you to relax
Yeah.
even more.
totally.
Yes.
Every time.
Yeah.
Yeah. Yeah. So we nip that in the bud with all of the.
I remember my very first session, and I said that too. And lo and behold, the fire truck goes by, and this woman had suffered from a house burning down. I mean, just all this weird stuff. So, but yeah,
Fire engines.
Yes.
definitely plant that seed, because it will work no matter what it is. You know,
Absolutely.
it adds to the effect of the suggestion.
I'll never before I became a yoga teacher, and I was a personal trainer, and I was teaching this, I was teaching a boxing class, and it was going on during the yoga class, which in my class was very noisy. And the yoga teacher asked me to be quieter. And I was like, I can't, no, I can't. I don't know. I'm not going to tell them. Yeah, I'm not going to tell them to hit softer. That's ridiculous. I was actually, and I'm a yoga teacher now, but I was a little anti-yoga back then. So I was like, absolutely not. I'm not, you know, and basically told her to go to hell. And so she just wouldn't let it go. So I said, fine. So I moved my class, and then she moved her anyway. It was a whole thing. We got a new teacher, and I walked right up to her and I said, listen, I run a class that time. I'm loud. They're loud. I'm not moving my class. And she said, okay, I wouldn't ask you to. I said, well, listen, it's really loud. And she said, I don't care. And then I said, I don't think you understand. And then she went,
She already figured out that the noise helps.
She said, you run a jackhammer for all I care. If that's going to disturb my class, then I'm not much of a teacher.
Mhm.
It was so funny. And I took that with me on into hypnosis, you know, but you're right. I think it's so, that's, yeah.
Because life, what I teach my clients is that life is going to be happening, and you're going to have to be doing this with yourself, for yourself, when we're not even together. So you've got to do it with the baby crying and all of that, right? You got to live. Yeah. Got to live.
So
Yeah, and we got to learn also that we can create that space for ourselves no matter where we are, no matter
Absolutely.
what's going on. In fact, in the most stressful situations is when we need to know
That's
how
the
to do
point.
this, you know?
Isn't that the point?
Yeah.
Yes, that is the point. Because I need to be able to go to my state of focused calm when I'm in the grocery store and they're cutting ahead of me. You know, I need to do it. Yeah.
Well, I got to tell you, a year from now, I hope that I will get to be able to check out some of your case studies, and we can have you back on. We can have you back on before then to talk about some more stuff, but
Absolutely.
would love to have a catch up on this and a report on it. And you know, maybe by then we have some more, you know, HEA members that are working in prison systems with the hypnosis.
There you go.
I think it's a great underserved, because that is one of our initiatives for the HEA.
Underserved population.
Underserved populations, you know, and you name it. You think of the ones that are underserved, and we want to help get people into those spaces.
I think that's a fantastic idea. That's actually one of the reasons I felt a little weird doing it, but I train mental health professionals to do hypnotherapy, but I've chosen to focus on BIPOC, right?
That's exactly right.
Professionals, yes.
Yeah,
Right.
because part of the reason why the prison systems are filled with people with mental health issues that didn't know they had mental health issues
That's
is
right.
because there's a stigma
That's
of
right.
getting any sort of help in the BIPOC community.
That's right.
And if we could just get this cleared up.
It breaks down so many barriers.
Yeah.
So many conversations don't need to be had when I show up.
Right on.
Patients.
Absolutely.
Yeah.
Don't need to drudge it all up, just go right
Let's
to
just
the.
get in there. Yes. Yeah.
We're here.
Yeah.
It's beautiful. And so do you train, so you're training people in
Yes.
therapy, and you're focused on BIPOC people.
And BIPOC people and women.
And women. Yeah. Of course.
BIPOC and women. I've got a class coming up in October.
Excellent.
Yes.
So please, so we're going to ask you to send that information over to us so we can have that on the website, because that's part of what we do as part of the Hypnosis Education Association, is direct people to trainings that are coming up. And I would look, we'll do that. Thank you.
And if you want to get me that information, I'll make it part of this this replay post too, so that people can find out how they can connect with you.
Sounds good.
And so what else should we know? So now we know you work in the prison system, but you also train hypnotherapists. So what else should we know that we don't know?
When she trains therapists, mental health, professionals
to use hypnosis.
To use hypnosis.
Right. Yes. Right. What else do I do? Yeah. What else do I do? During COVID, I started a podcast I call Transforming Trauma with Dr. Triffy that I do on my Facebook page, where my goal is to teach people how to transform really the pains of life, pain of childhood, especially, into passion and purpose. Power.
And that's how I caught wind of you, was that, and you talking about that, and we started chatting a few months ago, and I was just, every time you post something, it's like, I remember telling Mel, I'd go, this woman, she knows things. She's special.
Your love just beams from whatever it is you're doing.
I did. I was like, this, she's got us, because we're all about love. That's our motivation. I said, I feel it. She's got it.
The podcast.
She tries. Yeah.
And what was the podcast called again?
Called Transforming Trauma with Dr. Triffy. Yes. That's my free gift to the universe. You know what I mean? Like, just
right on.
teach skills that people would pay a lot of money for.
Yes.
Yeah.
Wonderful. So if you would, when you get a chance, go into the Facebook group. This video is there. It's going to be on. Just put that in the comments so that anybody who's watching can find that too.
Very nice. Very nice.
Is there anything else you'd like to add?
Parting.
What else I would like to add? If you have not yet obtained a hypnotherapy certification as a healer, as a coach, as any kind of mental health professional, as you were saying earlier, Melanie, nurses, people in pastoral counseling, psychiatrists, psychologists. I mean, this is a valuable tool that I would not trade, having learned for anything, not for anything. Yeah, because I have seen the power in my life and in the lives of so many people over such a long time. I don't remember a hypnotherapy session where I would say, well, I felt disappointed, or because it's not that, the focus is not on that kind of keeping score. Each experience is that experience. Each experience is its standalone, whatever we get to, okay, that's it, no judgment, no nothing, right? Often it builds. There are a couple people, right? There are a few people who have more difficulty.
Or their changes happened days, weeks after they were out of the office, but it was in that session. So it's for us to feel like we didn't get somewhere.
But that kind of process, it does a kind of excavating. And like you say, sometimes it a lot of the work is done outside of the session.
Mhm.
But people start making those connections like, aha, oh, wow, okay, I see it now. Yeah, and they come back to session and they tell you, okay, I understand, I understand. I understand myself better. I understand myself better.
Yeah, and I've had clients who, they've done their however many sessions with me, and part of me was like, oh, I really wish I'd seen a light go on even more in them or whatever. And those have just proven to me, because a year and a half later, they're writing to ask me to refer, telling me what the changes were, and they want to refer me to their brother.
That's right.
Like, so whatever.
That's right.
Thank you for bringing that point, because so many
Yeah.
people might be like, those little letdowns, what feels like little letdowns, they might let it get to them, but at least just know that it's almost like they say no meditation is bad meditation. I don't know if it's quite true that there's no hypnosis is bad. I'm not certain of that. But if you're skilled and you do help people, then I think you could be pretty confident that you're, all
Absolutely. I mean, as you were talking, I was remembering a teenager who had suffered so much with suicidal thinking. And I said, okay, she's suffering so much. We're going to try hypnotherapy. So we talked a lot about it. And she said, yes. When she finished that session, she said, oh my God, I feel as if my brain just got a massage.
Yeah.
Yeah.
That's the space being made for the change.
Yeah. And she's the kid who was struggling through high school. Let me tell you, is graduating this December from Michigan State University.
That's
The
cool.
person who I was like, oh
I
my
love it.
God, oh my God, oh my God. She was one client that I was like, she's getting ready to graduate.
Oh, it's beautiful.
Yeah.
So beautiful.
Dr. Wallace, do you ever speak at conferences or
I
hypnosis
do.
conference?
Well, no, I haven't spoken at a hypnosis conference, but I've done like at Georgia Professional Counselor Association. I haven't spoken at a hypnosis conference yet. I'm not sure why that is. I'm not sure why that is. I am a member of the APA's Division 30, which is the division in the APA for hypnosis. But I haven't presented at a hypnosis conference. That's something to consider.
Yeah, there's it's like you as hypnotists, we can get wrapped up in the for lack of a better term, like the celebrities in our field, the ones that speak at conferences all the time. And there's so many hypnotists and hypnotherapists out there that are they're just doing it week after week.
Yeah.
Who hears about, they're doing 20, 30 sessions a week. They're just changing lives. They're doing amazing things. Like you're obviously one of them. But so, yeah, I just wondered if you ever have. It's fascinating.
We'll have to see what we can do about that.
Yeah.
Let's go.
We know some people.
Let's go.
Thanks for bringing that up, man. I was already thinking
I'm the best.
Well, guys, I think that's a wrap. We should probably talk a little bit about some things we have coming up.
Sure. Here, take this sweet little
Let me
cup.
take this.
Awesome. Thank you so much, Dr. Wallace.
You're
Yeah.
welcome.
Blessing to us
Thank you.
and to all who are listening. And of course, as always, if you've loved this, then please do comment, give
Share
your
it.
support, and share this video.
Thank you for joining us on HEA's HypnoConnect, the podcast by the Hypnosis Education Association, a not-for-profit organization serving the hypnosis community since 1998. Proudly sponsored by HypnoBiz in a Box, the all-in-one platform for building a thriving hypnosis practice without burnout. If you enjoyed today's episode, be sure to follow, leave a review, and share it with a fellow hypnotist. Ready to grow with a supportive educational community? Join the HEA today and help us spread the word about the nature, uses, and benefits of hypnosis. Visit us at hypnosiseducationassociation.com. And if you're looking to get started, streamline, or scale your hypnosis business, head on over to hypnobizinabox.com, where you'll attract steady clients, generate reliable income, and be supported by a community of like-minded hypnosis professionals. Until next time, find a hypno buddy, stay inspired, and stay connected to HEA's Hypno Connect.